professor, physician, epidemiologist. I am Dr. Sri Banerjee. I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University. And in this video, I'm going to be going over this task force guide, this community guide. It's the Community Preventive Services Task Force. And they put together this wonderful, succinct guide, community guide, 40 pages, which allows decision makers to know the recommendations, and then based on this evidence-based approach to create interventions that will then be applied to the community. So what the CPSTF has done is they've created a number of steps, 10 steps, in first trying to create a topic, and this is something that not only applies to creating an intervention, but just in general how to arrive at a research problem or a research topic that you want to know more about. So this CPSTF guide provides an additional approach where you can do so. We start with selecting the priority topics, selection of criteria for topics. Of course, the selection criteria is very important to prioritize. And then if you're using team members, if it's a collaborative approach, get their opinions, and whether it's nowadays synchronously, asynchronously, in whatever way, see what the team is comfortable with. And there's creative ways to do this collaborative process in step 2. Then the next step is to actually select an intervention approach. And there's actually several intervention approaches, examples of approaches that have been provided on page 10. But if you look in the appendix at the end, there's quite a few wonderful examples. Then you go through so continuing onward with the number of steps to the 10 steps in community guide effectiveness review process. I talked about selecting the topic, selecting a review topic based on CPSTF prioritization, and then creating a team. That's important, number 2. And then third, selecting an intervention. Selecting an intervention within the topic. This is really crucial. And then number 4, conceptualizing, defining the intervention, crafting the analytic framework, identifying outcomes. That's important. And then systematically searching for and retrieving evidence. That's number 5. So that's these are steps 1 through 5. Very important to be thinking about when creating an effective intervention. But then you're not done, because then in number 6, you're trying to screen and narrow the retrieved set of papers down even more. And I've provided techniques and guidance on how to do so. And then number 7 is evaluating studies for quality and collecting information from papers, abstracting out information. Again, there's some examples of that that I've shown before. And then analyze data from included studies. Look at what's in there. And then a lot of times we end there, but number 9, we have to go further. We have to make sure that these translate into CPSTF recommendations. Now, this could be recommendations that you create for whatever you're making for your research topic, but this is for CPSTF. And then finally, dissemination. Make sure everybody knows what you found. Pretty simple and straightforward there. So this is actually just showing you how the CDC plays a role with CPSTF to try to provide guidance. This actually shows some of the criteria used to select topics over time. And so for CPSTF, some of the priority areas which were selected based on alignment, based on balance, based on burden. I mean, if there's a high burden of severity, then definitely that's something worth exploring. Based on coverage, the ability for CPSTF to develop recommendations, based on the existing disparities, the health disparities that may be addressed by population level health intervention approaches, the impact, the preventability, and then finally, partner interest. Are people interested in working in these areas? And so they actually came up with 9 priority areas based on the criteria that I just read to you. And so these types of criteria can be good to identify topics for yourself as well. And that's why I went through them. But heart disease and stroke prevention, number one cause of mortality, so it's important. Social determinants of health, not surprising, very important. Substance use, injury prevention, mental health, tobacco use, violence prevention, nutrition, physical activity, and obesity, and preparedness and response. So these are the 9 areas between the periods of 2020 to 2025 that were identified as priority areas. So this can be used to kind of prioritize the types of research questions. And of course, this guide provides teams that may be comprised of 6 to 10 people, but many times you kind of get a broad perspective, having different people have what they bring to the table. So there's different ways to do so, and different ways asynchronously you can contact experts in the field for that. Okay, so that's step 2. Now, looking at step 3, just selecting an intervention approach. This is important. So what are the types of intervention approaches? Maybe there's some sort of team-based care that you're proposing to improve blood pressure control. Maybe, so that would be something that would be considered services. Maybe you're proposing a behavioral or social program. You want to reduce risky sexual behavior, an intervention that reduces HIV or other sexually transmitted infections. Or maybe you're trying to create a behavioral intervention to decrease youth pregnancy. So that's one approach. And then the final approach, example of an intervention approach, is an environmental or policy level approach. So coordinated built environment approaches combining elements of pedestrian or cycling transportation systems with land use and environmental design features. So I know that's kind of a mouthful there, but basically creating an intervention that alters the built environment in order to promote more physical activity within the environment. That is the main purpose of having pedestrian and cycling transportation systems. Um, and also, this is kind of an environmental health improvement, because then you have a decrease in the combustion of greenhouse gases by decreasing transportation. So this is kind of something that can be looked at in the context of existing systematic reviews as well. So with step 4, you have kind of a conceptualization process that uses 5 key elements. So the elements may be addressed at the same time, and the process may go back and forth. So there's an intervention definition. You have to kind of define the intervention. So let's put it this way. What is it that this intervention must have? What does it need? That's what you need to figure out. What are the essential aspects of the intervention? These directly inform inclusion and exclusion criteria. And then from that, you want to make sure and see what is it that it may have. So it's not stuff that's essential, but it varies on how an intervention is implemented. So draft the definition, determine inclusion and exclusion criteria, develop research questions, develop analytic framework, and then consider applicability factors. So take a look at this conceptualization process here. So now in this portion of step 4, we get into understanding how to determine the inclusion and exclusion criteria. So the first thing, I think it's pretty simple to figure out. If the community guide, if the intervention that you're creating, it has to be designated for a high-income country, then a World Bank designated high-income country is what you want to conduct your study and intervention for. If it must be published in English, that's one of the criteria. And so this goes into some designations of that criteria. Other factors to consider, and to me, I wouldn't even really think of this as other factors. I actually would call this out specifically if I were to create this guide. But this is an important other factor. Community guide reviews generally consider all types of comparative study designs, and these study designs are epidemiological designs, which I have extensive expertise on. And these are experimental studies with allocated control groups, observational studies with concurrent or historical control groups, and observational studies with a single group before-after comparisons of change. So these are very important types of study designs which can provide insights for the community to create interventions. And study design exclusions are usually topic, intervention, or outcome specific. And then the next part of this, of course, is the Picos Framework, which, of course, if it were up to me, this would be number 1. And it can help focus systematic review, inclusion, and exclusion criteria. And I have lectured on this extensively elsewhere, but this has been provided for the sake of completion on the right-hand side. And these are some good questions to be asking, just briefly, for Picos in order to narrow down your research topic. So, of course, the next portion of this conceptualization has to do with understanding how to construct the research questions. And now, this is not something that happens overnight. It takes some skill development to do so, but I think practice makes perfect with this. Instead of trying to get the most perfect research question the first time, it's more important to kind of take the principles that have been provided. There's two basic principles. Research questions ask if the intervention works. And now, so I'm gonna make a note here, a specific note here. Research questions are of all varieties, of all different varieties. And this specifically is geared towards asking if an intervention works. Not all research questions will do this. And not all research questions actually have to do this. But this is something that is a specific type of research question where there's an intervention that's there, and the question is being asked if it's actually something that is helping or not. And the other note that I'll make is that there's indirect ways to measure the effectiveness of an intervention in different creative ways than you would think. And so what I mean by that, there are certain policy enforced interventions that may be implemented in certain states, and in other states it hasn't been implemented. So that causes kind of comparison. So with the research questions, it does take some time, but I think if you follow these principles, you'll be fine. So these types of research questions are specifically for interventions. Try to keep that in mind. But then, of course, you can apply some of these same principles in other types of research questions as well. So, does the intervention improve study participants' health outcomes, quality of life, reduce morbidity and mortality? These are questions that are asked very frequently. And then through what intermediate steps, and I actually specifically lecture on intermediate steps, are these outcomes achieved? And sometimes what are factors that make outcomes worse? That is also something that is studied. And of course, so this is where I'm saying that interventions are actually not the sole focus of everything, but the perspective I'm presenting in this guide is only looking for factors that actually improve health conditions rather than make them worse. And so that this is where intervention guides and intervention studies deviate from just a regular type of research question or research study. So additional research questions may address implementation of the intervention. Does intervention effectiveness change based on intervention settings or the population or intervention characteristics? So maybe it worked in an urban center in Chicago, the intervention, but then when you change that around and see if there's the same sort of efficacy in an urban center in Pittsburgh, then that might not be the case. So it's good to see where these interventions are effective, and see if there's generalizability of the findings. The fourth step of, well, I should say, the fourth part of the fourth step is the analytic framework. And what I'm going to do here, this analytic framework, there's no better way to do this than to show you one of the analytic frameworks. So here we go, and I'm going to adjust this frame. So here's a sample analytic framework, and there's a lot of different things going on. I'm not going to go through every single box that is going on, but this gives a good depiction of not only an analytic framework, but it actually gives you a good basis for any sort of concept map. If you think about it, if you're familiar with logic models, these are also sort of maps, concept maps that provide arrows and provide directions of relationships. So let's take a look at what's going on. Federal, state, local policies affect school-based health centers. And then the school-based health centers, and let's take a look at what these arrows mean. So the arrows are causal relationships. So the school-based health centers then are causing, of course, health education, improved health education, improved patient comfort, satisfaction, increased use of recommended preventive services then, if the school-based health centers are actually being used, increased access to services, and sometimes this may be wishful thinking, but it's a possibility that increased earlier diagnosis. Um, so these are all the effect of policies that would increase the number of school-based health centers. Everything in this analytic approach means something. So the red is a recommendation outcome. All of the red that you see is all a recommendation outcome. So a direct result of the school-based health center recommendation outcome would be increased use of recommended preventive services. And then, so if you follow the red here, the red box to the next red box, then that actually is, again, another recommendation, which is increased and earlier treatment of infectious diseases. Of course, we all want that. Chronic diseases, we want to catch that early. Improved and early dental health and mental health services. And in effect, what that is going on, what that causes, and that's a dotted sort of box, is the potential benefits and the potential harms. So let's see if it's a potential benefit or a harm that they're emphasizing. The first thing, reduced transportation time. I think that's a potential benefit. Reduced cost, potential benefit. Reduced parental healthcare time, definitely benefit. Decreased fragmentation of care. All things that we want. So definitely all potential benefits of recommendations that have come out of an intervention. So this is all connected. There's potential effect modifiers within there. And so those have been placed on the bottom left. And so, as you can see, all of these boil down to one thing, and this is something also I want to emphasize in this analytic framework, is that it all boils down to health equity. So if we look at health equity, there's different ways that we can kind of address health equity. And so this is one analytic framework to effectively do so. So I'm going to end step number 4, the analytic framework, by telling you about the components in a community guide analytic framework. So these include the intervention under review, the population of focus for the intervention, the intermediate outcomes, the health outcomes or well-established proxy for a health outcome. And so key potential effect modifiers, and I talk about effect modifiers a lot. And so there may be participant characteristics or intervention characteristics that modify the effect of the intervention. And this is extremely important to pay attention to. And then additional benefits and potential harms occurring outside the causal pathway of the intervention. So these are the 6 takeaways from step number 4. So the next step that we're going to look for is applicability factors. And think about all of the 5 W's. What works when, where, and for whom. Kind of think about where this applies. And so sources for evidence and considerations, and they use the word a priori hypotheses. So kind of before the review. So the body of evidence, so looking across the body of evidence to assess the differences among study participants and intervention settings and characteristics, to determine whether the intervention is effective across different populations and conditions. Like I said earlier, it may work in one setting, but then in a different setting all of the parameters and factors change, so then things are different. Also individually included studies. So are these studies based on factors of interest where other factors were not really even considered, but determined to be important for the intervention to review? Also, evidence beyond the included studies. So there might be something else that is not being considered. So for instance, if all the included studies, like there's a huge overrepresentation of studies from high-income countries like United States, usually regarding an intervention, then the review findings or generally acceptable findings are only applicable to the United States. Maybe it's implemented in the urban settings and not rural settings. So these are all considerations to be thinking about. Demographic factors and a priori hypotheses will be based on how well these are considered. So there's 3 possible hypotheses, and I actually especially appreciate this because it shows not only that there's one where most people look at, probably applicable. The team does not expect the factor to influence intervention effectiveness. So, for example, mobile phone-based interventions remind patients to take medicine probably work in all high-income countries, including the United States. So that's an hypothesis, and you can work off of that. Then there's effect modification. This is something that is understudied, heavily understudied. And the idea is that the factor likely will influence intervention effectiveness differently for different groups. This was seen with the COVID vaccines with age groups. Different age groups were affected differently. Different races were affected differently. Similarly, interventions with diabetes control interventions, the intervention effect will vary based on patients' baseline blood glucose levels. So simply just based on that this will provide differential intervention effectiveness. And then, of course, there's the unsure, where, for example, the intervention to increase cancer screening it may or may not work. It's worked sometimes not, so who knows? So that's the caveats for trying to determine about interventions and trying to evaluate the body of evidence. Not easy. So we were still actually going over step number 4. If I at any point said that we had moved on to 5, I had misspoken. So now we actually are ready to move on. Now that we've determined the different types of hypotheses, now that we have determined the different types of literature that may be out there that you may encounter, for interventions, now we're ready to systematically search the literature. And of course, I already introduced to you the acronym Pico, and provided you some brief tips already. But existing reviews on the intervention approach of interest should be investigated first. And search strategies are broad enough to capture all relevant evidence. That's what you want, but you want to also minimize bias. And actually, the way to do this is to include as many search strategies and searches as possible. So here are the 5 main search databases. This is not all inclusive, but CINAHL is actually a nursing database that I use as well, in addition to this. But Cochrane, Embase, Medline, PsycInfo, PubMed, very inclusive and extensive databases to be searching at. So that's step 5, a lot shorter than step 4. And now we're ready to move on to screening the studies that have been identified in the search. And to me, this visual over here, figure 4, this sums it up completely. You have all these papers, you have all these, when you first start your literature search, it's just the whole, you have a whole host of papers to go through, and it's exciting, it's fun, you're learning new things, and you're putting all of that together. So each screening stage is more discriminating than the previous one. That's the idea, resulting in studies with greater relevancy. So you can screen by title. So this title doesn't look good, that title looks good. You can screen by abstract, and then, realistically speaking, practically speaking, you just do not have time to go through every single full text, correct? So best way to do this is to do this kind of 3-stage screening process. I've shown you many techniques to try to narrow down your research topic, but it's only when you start to use your unique combination of techniques that you understand how to use your own way to narrow down research. Sometimes this requires 1 or 2 screeners, so just kind of making note of that. Once screening is complete, then the Prisma flow diagram depicts the flow of information through the different phases. So we're still kind of using Prisma here. So the one acronym that I introduced to you earlier is Pico, and I've been talking to you about, but I think Prisma is another one, and I've lectured on this extensively elsewhere, so I'm not going to go into this a lot, simply because it's going to add to too much, a lot more lecture time to this one. I mean, I want to keep this as brief as possible. So did you know the coordination team may add inclusion criteria to narrow a review? So you can kind of add inclusion criteria as you go along, even later in the process. Step 7 now is abstract relevant information from selected studies. So how are you taking out information? Of course, you can, and sometimes matrix, creating a matrix helps to do this, but you can record the study design, pertinent details of the intervention, provide enough details of the intervention so that you can refer back to it later. Methods used in the study to evaluate effectiveness, outcomes of interest, potential benefits and harms of the intervention, and information for applicability assessment. So the abstraction process is kind of a drawn out process, but I think can provide kind of a good guidance to try to narrow down your topic. So there's ways that you can, even at this point, try to limit the types of studies that you're including within your literature review. Studies with limited quality of execution, they're excluded. from the remainder of the review. So you still want to ask some of these screening questions for the studies that you have remaining about, for instance, was the study population well described? Was the intervention well described? What was done? When was it done? How was it done? Where was it done? How was it targeted to the study population? Then go into sampling. What's a sampling frame? Or universe adequately described, inclusion exclusion criteria, eligibility population, or probability sample at the point of observation. So sampling is important. And then measurement. Were outcome measures valid and reliable? Exposure to the intervention assessed? And if yes, were these exposure measures valid and reliable? And then you have data analysis. Was the appropriate statistical test used? Reporting of analytic methods, appropriate controlling. So interpretation of results, again, 80% completion rate. All of these are all very crucial and important to follow. Assessing suitability of study design and quality of execution, and then categories of suitability. Which ones are most suitable? And so there's two things that this actually does. These categories. This is one that you really should, if you're especially doing quantitative research, should know very well at the back of your palms, basically. And that is that randomized controlled trials and prospective cohort or concurrent comparisons have the greatest suitability of study design and quality of execution, and evaluating effectiveness of interventions. And then interrupted time series studies, retrospective cohort case controls, they're moderate, and then uncontrolled before after cross-sectional, they're the least in studying effectiveness, or even just conducting any sort of studies. And so this is kind of a quick example of the suitability of study design, and ones that were greatest suitable in diabetes. And this is example study effect of community health work for diabetes prevention. And the studies of greatest suitability was provided versus least suitability. And so this is where the information came from in trying to understand that. So the final three steps, steps 8, 9, and 10, are kind of self-explanatory, and of course analyzing the abstracted data. Use the analytic principles that you may be familiar with in order to, and the framework that was introduced in order to understand behaviors, health, morbidity, and mortality outcomes. Also, any sort of behavior and clinical changes that have come about as a result of the intervention may be important to note, especially because this may result in potential changes in recommendation outcomes, for instance, health or health-related outcomes. And then also evidence from included studies are used to group studies by recommendation outcome. So as you can see, the focus is around recommendations, and I'm going to come back to this before I end this this lecture. But it's really important that these recommendations are tied to the findings that have been yielded here. Analysis methods using descriptive statistics, median, interquartile range, to report population characteristics such as race and ethnicity, intervention characteristics, for instance, intervention components, duration, and characteristics such as sample size. So when you're looking at an intervention, very keen on looking at the intervention, the setting, populations, and study. So I want to make a note here at this juncture about the nature of interventions. Interventions can be intentional in nature. So what I mean by this is that you have, for instance, an exercise regimen, a 6-week exercise regimen that you're trying to implement, and you make a measurement, maybe a weight measurement before the exercise intervention 6 weeks, and then afterwards, and then see if it's effective. Another way to do this is that you can actually compare those individuals that may have naturally been engaging in exercise, and then comparing this group to individuals that may have reported not engaging in exercise. And then, so you naturally have now created an intervention that wasn't actively provided in there, but you are assessing the effect of a potential intervention that were there that would be implemented if there was an exercise regimen there for 6 weeks. So this is an example of how you can actually create the effects of an intervention without actually having an intervention. So other analysis methods, of course, using narrative synthesis and descriptive statistics to report results. This is a really good way to have recommendation outcomes. And then grouping studies by study design. And so analyzing studies of greatest suitability of design together. This group especially pays close attention to the types of studies and how effective they are, how effective the findings are, what is the level of evidence of the findings, and then depicting these results by scatter plots, graphs, and tabular displays are important. So here's more specific details about analytic methods. Applicability analysis, again, very important in considering. These are areas that you can kind of go over on your own. And then assessing meaningful impact, included studies in the systematic review. Just considered everything. Now, step 9 is translating a lot of these findings to actual recommendations. And this is where the decision table comes in handy and is really important in modifying findings. And so if there's sufficient information to kind of, or included studies meet criteria for sufficient but not strong body of evidence, then of course the magnitude has to be assessed in order to support upgrading the strength of evidence or not upgrading the strength of evidence. So the strength of evidence and translating evidence of effectiveness into recommendations. This is really important. At what point do we raise the alarm bell? That's the question. When does CPSTF say, okay, these findings that we have just arrived at needs to raise the alarm bell, and so we have to modify the recommendations. So this is a sneak peek into how that decision is made. It's somewhat systematic here, and so you have strong. If you have strong evidence, and these are the criteria for strong evidence, then the recommendations are changed. And then, of course, sufficient, and then insufficient. So sometimes there's ongoing kind of information that is needed to be acquired before any sort of recommendations can be finalized. So that shows how the modifications are made in recommendations. So that's the evidence decision table. And then so considerations for implementation. Implementation considerations offer guidance on what others should be aware of when attempting to implement the intervention under review. So this I found interesting too. Upgrading the strength of evidence from sufficient to strong based on a large magnitude effect. So effect size is important. The magnitude of effect is also very important. And this is another kind of figure where there's a decision tree where if there's a body of evidence which otherwise meets CPSTF decision table requirements for conclusion on effectiveness and recommendation regarding use, so then you upgrade based on strength of evidence rating from sufficient to strong. You downgrade, you either narrow the recommendation or so downgrade finding to insufficient evidence. So these are all of the different choices and options that the CPSTF has to go through in order to translate policy to recommendations. So this is a good example of this. And then you finally, once you've gone through all of that, then you're ready to get to the final step. So now that step 9 is done, we're ready for identifying any sort of gaps that still may be existing, but more importantly, we're ready for dissemination. And this community guide has 25 years of evidence-based findings for population health. And so here's a couple of up-and-coming topics that are front and center for for the community guide, and that is what works to prevent HIV, STIs, and teen pregnancy. I think that's one that I briefly went over previously. But what works to prevent motor vehicle injuries? And so these are all important questions that are being asked. And interventions that there's relatively simple solutions to if implemented sufficiently and adequately with the principles that we just went over. But I encourage you to go over this website as well. This is www.thecommunityguide.org. And this is where you see the implementation of all the different interventions that were developed with the technique that was outlined. Now you'll see some of these are a bit dated. For instance, there's one from 2012, but the recommendation, there's strong evidence according to the evidence level that I had introduced already. And talking about excessive consumption and alcohol and actual electronic screening and brief intervention right there in an electronic tool. So there's an intervention that has been not only provided with a snapshot, but when you look at one of these interventions, they're actually arranged in a way that they provide you with a good summary. So for instance, the CPSTF actually recommends electronic screening and brief intervention to reduce self-reported excessive alcohol consumption and alcohol-related problems. And so with traditional brief interventions, providers assess patients' drinking patterns and offer those who screen positive for excessive drinking with a brief face-to-face intervention. That's what's done. But what this ECBI, the electronic version, does is it screens individuals for excessive drinking and delivers a brief intervention. It provides personalized feedback and also provides risks and consequences of excessive drinking. So this technique actually is a brief intervention which includes motivational and interviewing techniques. So it will right there and then and there assess the readiness to change, emphasize the personal freedom to choose one's drinking patterns, and then compare an individual's own alcohol consumption with that of others. Maybe like college students in the same school or something within the same demographic variable. So this is an application and example of all of the studies that were conducted. They also go through a sample analytic framework that shows all of the connections and logic behind the excessive drinking intervention. So similarly, go through a lot of these others. Some of these actually have been recently modified. One of these is the fact sheets that have been modified. And then finally, you can submit your own story. Tell us your story. Tell the community guide stories of action that you are actually engaged in. And so, for instance, for diabetes, combining diet and physical activity promotion programs to prevent type 2 diabetes. There's so many programs out there. So report things that you're working on, interventions. And then, so I hope this tutorial and this demonstration has given you a lot of information, the 10 steps, and another approach to really hone in and narrow down your topic. Whether you're working on an intervention in particular or trying to identify risk factors of a chronic disease that exists and requires more information. These are all the fundamental principles to use to better narrow down your topic and hone in on your research area. Thank you for listening.